got stress, cause we're striving, surviving, keep on moving to improving, rearranging. The whole world's changing, pandemic, systemic, rule making, rule breaking, disagreeing, are we fighting or fleeing? Got a mind.
Welcome to Minding the Gap. I'm Paul Bakke, licensed counselor with Behavioral Sciences of Alabama, and we are bringing this to you with Dr. David Barnhart, also a licensed counselor, and we're going to talk about exposure today.
I'm looking forward to this. Exposure is a big deal, and it's a word that has a lot of different meanings.
It does.
Yeah,
it's not
some
the
of them
bad
aren't
meaning.
good. Some of them
Right.
aren't very good.
It's not the bad one. You know, when I say, "Have you heard of exposure therapy?" and somebody has not heard of it, they
That doesn't sound right.
I'm not sure about all that.
Yeah.
So, okay. So just the basics of it is that in any kind of situation where we have some kind of stress or some kind of uncomfortable feeling, the natural tendency is to do something to avoid that feeling, which in some cases is a good thing because it saves our life in the case of getting out of a car because we get a scared feeling, getting out of the way of a car. But in the cases of anxiety and OCD, and even dealing with grief and sadness and those kinds of things, avoidance is not helpful. It just perpetuates the problem. So exposure is facing whatever that trigger stimulus is in order to resolve it.
Mm-hmm. This is what, if you think about situations that make you feel uncomfortable, just coming to therapy for the first time.
That's right.
Particularly, it's an exposure.
That's absolutely. I had a session with a young man, young college freshman, and he was talking about, and he's got anxiety, and he was talking about how hard it is for him to talk to people, especially new people, and he doesn't like talking about his feelings anyway. He just sort of pushes it down, and so that's exactly what I said to him right away. I said, "You're just by telling me that right there is exposure. You're doing what you don't like to do. And with practice and with anything else like that, we get better at it."
So we talk about habituation. So why would you do exposure? We have a word for virtually everything, don't we, Paul?
We do.
And you could just say, well, it's like you're getting used to it. That might be another way of thinking about it. It's pretty. But the concept is that with repeated exposure, we eventually habituate or get more used to the triggers, so the triggers aren't as triggering. And why would that be important? Why would we want to decrease the emotional response to triggers?
Well, for one thing, the triggers are not just going to go away. And so the more a person can face a trigger, a thought, a kind of uncomfortable feeling that comes up, and have a lower response as a result of habituation, the more they're able to face it and get over it. And we've talked about this in the book, in the workbook that we have, living and
yes,
writing and living
your fears away. Yes,
my brain's not working.
No, I do the same thing.
Yeah, we just switched it up a little bit. It was writing your fears away.
So our original book was Write Your Fears Away.
Right. It was about writing it. And when we really kind of added the exposure component, which is living your fears away. So in the book, we talk about how someone that has anxiety that's more of a normal level, that's not a problem level, basically will have a little bit of nervousness in talking to someone, enough to sort of motivate them to think about what they're going to say, and
Mhm.
they're going to do it anyway. And then it's easier to kind of get over that hill, when we kind of call it.
Mhm.
Um, but and so the normal process, when we have a lot of anxiety, is we're dealing with those things, and by dealing with them, we get better.
Mhm.
But when you have this big hill that really seems an insurmountable climb, it makes logical sense to avoid that, but avoiding it doesn't help, doesn't make it better. And so with any kind of practice, whether it's talking to someone, whether it's facing a trigger, even a thought that you can't help, with OCD, there's these thoughts, you can't just make them go away. You can't just say, I'm not going to think that. So they just pop up. And so when those kinds of things pop up, they're connected, they become more connected to a lower level of response that people can more easily say, that's just a thought. I don't have to stay on that. I don't have to do something to make it go away. I don't have to avoid it with some kind of behavior that only perpetuates it.
Yeah. So avoidance actually strengthens avoidance, and that's part of the trap.
Right.
So we let's think about if I have germ phobia, and I'm think about catching a disease. I might pick it up from the surface of something, you know. So I start avoiding touching a doorknob. So I'm going in, I don't want to catch a disease that somebody else has and they have it on their hand. And there's some logic to this, because you can spread like common colds and other things through contact. So it does tie into our basic tendencies to want to live and be healthy. But when we become overly anxious about that, when we start to touch a knob, we'll try to avoid it. And we might use our sleeve. So we might pull the sleeve down over our hand and then turn the knob with the sleeve. Okay, well, now I've done one thing. I've learned to use something.
Yes.
People do this. You see people go indoors and do that kind of thing.
Yeah. I've
Then
improved my avoidance.
exactly,
Better at it.
and you will get better at it. And it's there. At some point, it can become so problematic that you feel like you can't sit in a chair that somebody else sat in.
Yeah.
This is when it begins to become dysfunctional. So we're avoiding
Yeah.
sitting in a chair that somebody sat in, or using a computer that somebody else has used. And again, it can tie into some contamination issues, but generally speaking, we're not dealing with things that we easily contract. I mean, so we're typically not going to pick something up by touching a doorknob. But it doesn't.
The thought gets connected to the feeling.
Yes.
And then the thought becomes strengthened as well.
Yes.
Yeah. And it's the same thing with something like, a kid that's texts only,
Mm-hmm.
plays video games all the time, and doesn't have any social interaction, and is it's got some social anxiety, and so just doesn't put them in a position to talk to people and kind of risk the riskiness of social situations. And they get better at relieving their fears and their anxiety with avoidance, whether it's using their phone too much, or computer and that kind of thing, and isolating. And ultimately, and that's the problem with it, it's a short-term relief. Ultimately, it leads to more anxiety and more loneliness and sadness and more negative outcomes. So again, we've talked about this a lot. you were in exposure, you're having to go against what you've either learned or what's instinctive to face something, because there is going to be anxiety in exposure. That's the point.
Yes. And I'm glad you brought up this social anxiety. But let's talk more about that. But across the board, exposure is a form of treatment that is very effective. Probably 75% of the time, it makes a significant difference in a person's life. So it's hard, but it extends. This type of treatment actually extends across all of the anxiety disorders. So social anxiety, even generalized anxiety, which is more non-specific, kind of more worry-oriented kind of thing. OCD and other uh, types of issues. You mentioned a broad range.
Yeah.
Even in depression, we will use exposure, or even in grief situations.
Right.
We do it. It's a little differently, different concept, but
Right.
the idea is really learning how to face
Right.
the difficulty.
And with grief, we, we're sad. If you've lost someone that's close to you, that's the response we're supposed to have. We miss
Yes.
them.
Mhm.
It's it's painful. It hurts.
Mm-hmm.
That feeling is not pleasant. So there's a natural tendency to avoid that feeling and to stuff it away and put it and don't talk about it. And for other people who are sad and see children that are sad or see other people who are sad and say, oh, don't be sad. Don't be sad. It's okay. And take it away from them because they don't want to deal with their sadness, and they don't want their kids to deal with sadness because sadness is not good. And, oh, your grandmother wouldn't want you to be sad. You hear that all the time, Yeah, of course not. They don't want you to be sad, but sadness is okay.
It is okay.
It's okay. And if you think about anybody who's experienced any kind of grief, crying and being sad when someone has died it's awful in the beginning. It's terrible. It's painful. And then the next time you feel it and you talk about it and you're sad, it's a little bit less. And the next time it's not going to go away. It's not going to go away. But the point is, the more it's expressed as a form of exposure, the less intense it becomes, and the easier, or the less intense, the easier it is, I guess, to talk about it and even get into the good things like good memories and those kinds of things. So,
oh yeah.
So anyway, it's this. Once again, we've talked about this a lot with anger, with anxiety, with sadness. Our brains are telling us, no, don't go there. Don't go there. And so we're having to do something that's purposefully painful, but it's for a reason. It's for it to get better. And I was talking to a client that's does exposure with we call worst case scenarios, where he worries about things that happening, and so he writes them down and he talks about them, and he faces those thoughts about the worst case, and anxiety goes up. And we were talking about the homework that he has to do, and it's similar to working out, because you're exercising and you're doing something that's difficult, and sometimes it's not very pleasant, but then over time you get better at it, and you get healthier and you feel better, and the level of difficulty gets easier. The difference, though, is it's never pleasant.
No.
I like working out. I don't work out to the point where I am at a 9 or 10 discomfort level. I don't have to do that in order to exercise and be healthy. But sometimes with it,
Nobody's paying you to compete.
With
Yeah.
exposure, there's not any pleasure in it.
Hmm.
It's just straight up uncomfortable.
Right.
And so it's very difficult for people to choose when someone's not standing there going, okay, go ahead, to decide, okay, do I play video game, watch TV, relax, read a book, or make myself feel terrible? It's difficult. And so it takes a lot of courage, and it takes
does.
a lot of sometimes a lot of trial and error, and a lot of people that we talk to say, well, yeah, I need to do it more. I didn't really do many worst case scenarios. I thought I was doing better. Then I worried for 6 hours in a row. I was hoping it would go away, but you're going against nature to do it.
Yes, and so we probably should talk about a couple of things. One is the upside of doing this, and also just the kind of the strategy. How do we structure exposure so that it's effective? Just a kind of a quick thing. This is many years ago. There was research done with post-traumatic stress disorder, which is an anxiety disorder, with veterans, and they were using expressive writing, having them write about these events that they had experienced. The veterans with PTSD, and it was a very brief intervention. Actually, it had about 3 parts to it. And it kind of went along a course where they talked about it, and then they wrote about the events, and then they wrote about in more detail with more emotion attached and so forth. So there were about 3 exposure sessions, and then this was a quick thing. They looked at 2 weeks later, and some of the symptoms, a lot of the symptoms like flashbacks and nightmares had decreased substantially, even with 3 exposure sessions. That's pretty interesting and encouraging. Of course, we've been doing worst case scenario work for at least a dozen years with OCD, with intrusive thoughts, fears that people have that something bad is going to happen, and what those worst case fears are. And we see the same kind of thing. So we see this intensive kind of work where people face their fears, and it's prolonged. So it's over a period of time. We see this reduction, and once they turn the corner, it's like, oh, you can see they're making progress. They're going, oh yes, I'm feeling better. What a relief that is to see. Oh, this actually is helpful. It's useful. So there's a really a long history of this in treatment, but it's unpleasant to think about doing this, and so our tendency again is to avoid doing it. Where OCD is concerned, the average length of time before somebody is diagnosed, from the time symptoms first appear to when they're diagnosed, is about 17 years.
Yeah. So at that point, they're real good at avoidance,
putting it off for a long period of time, because we don't want to share those kinds of thoughts, like thoughts that you might stab somebody. Well, it sounds pretty horrific, doesn't it? If you had a thought that popped into your head that you might do that, that is likely a symptom of OCD. We call that an intrusive thought. We call them unwanted intrusive thoughts,
Mhm.
and they evoke anxiety, and that by itself is pretty diagnostic.
Yeah, and those things just they pop up. They just happen, and they can range from hurting someone to
Hurting
religious,
themselves.
hurting themselves, religious worries, sexual kinds of things, people being afraid um, of abusing a child, that are just literally, and intrusive means unwanted, can't help that it pops in there, and it causes anxiety. So it's not to be confused with, what someone may say as a perverted thought, like that they want to do something negative. They don't want to. They're upset that this thought comes up, and they're worried that they're going to do it, and they spend time trying to figure out how not to do it. And
Yes.
which includes, I'm not going to get on my computer. I'm not going to even look at a picture. I'm not going to look at a kid. I'm not going to be around a kid, because they're so afraid to do this, and they become trapped in these thoughts when they're the least likely to do it, because they're so afraid that they're going to do it. And it's this cycle that's very difficult to get out of. So exposure would be moving towards those thoughts, saying those words, thinking about those scenarios of being arrested or hurting someone or whatever those things are. And they're really, to someone that's not a professional, that doesn't know anything about it, they'd seem pretty bizarre.
Yes.
The
Oh,
treatment,
yes, absolutely. Yes.
What do you mean you and your client are watching YouTube of somebody throwing up?
Yes. Yes.
For someone who's afraid to throw up.
Right.
You know, what do you? That's crazy. What are you
It
talking
is.
about?
It is. Yeah.
What are you doing? Satan worshiping activities in your session for? That's you're just inviting God to come and just snatch you up. And but these kinds of things, the fear of the religious things, you're just moving into whatever the fear is, because it's OCD.
OCD.
It's not sacrilegious. It's treatment for OCD.
Yeah, it's very uncomfortable to think about. And people have to have a lot of confidence to take the risk to do exposure, because it is so counterintuitive.
Hold this knife next to my neck.
Yes.
Just hold this knife against my neck.
Yes.
I mean, before I started doing this, I would have thought, what? No.
That's not therapeutic.
Right. But
right.
It's that's what it is.
Well, it goes against the grain of, we want people to be comfortable.
Go ahead.
We're always trying to give them reassurance,
Yes, it's okay. Oh, you're not going to do that. Don't worry about that. Let's talk about something else.
Yes, move on.
Have you ever done anything? And that's so exposure in these cases are cognitive therapy, cognitive restructuring we talked about is a part of it, but that's not enough, for them to go, oh, that's just a thought. I know I'm not going to do that. I've never done that before. That's helpful for them to do some practice with that, but that's not going to help them deal with that feeling that comes up. And it can become a little bit of an avoidance.
Yes.
By doing that. So focusing on allowing themselves to think about it, feel it until the feeling, and the thing that we haven't mentioned here is that when you do exposure, if you think about the avoidance makes the feeling go down, exposure makes it go up, and our brains will not allow the feeling and the chemicals that are going through our brains to continue forever. So eventually it will drop by itself.
Sure.
And that's, as we say often, is one of the keys of it. It's doing exposure long enough that it comes down and there's relief. And so you have trigger is now connected to relief instead of trigger connected to I've got to avoid it quickly. It's connected to if I just outlast it, I just wait it out, I just ride the hill, ride the wave,
Right.
it's eventually going to come down.
Now, so we actually do this incrementally. So we don't necessarily start with the worst case scenario.
Right.
Sometimes we do. It really depends on the goals of the client and their interest in getting to a place pretty quickly. So we'll usually structure things. If we take an example like eye contact is an issue for people with social anxiety sometimes. So they're uncomfortable looking people in the eye. Well, we'll practice making eye contact, and we'll do that in some ways, like we'll walk through a mall, back when you walk through malls, and people coming toward you, and then we have the client practice just making eye contact, just quickly take a look at somebody's face and move on. But let's get 150 of those faces in the next hour and a half, and then let's repeat it. And then as you become habituated to that, now we're ready to move to the next step. Now, that might sound pretty easy, but if you've got high levels of social anxiety, even making eye contact is difficult.
And create that anxiety that goes up more, leads to more habituation of the same kind of thing with someone's fear of with a fear of heights. Speaking of the mall, they may go to the mall on the second floor and walk around the second floor in the middle and kind of look over the rail and think about the drop. And then as they get better, get a little closer to the rail and get a little closer. And so your point about starting small, hopefully gaining some success early with some easier things. So we talk about creating a hierarchy, which is a list of things that trigger the anxiety and then ranking them from easiest to hardest. And then having the client decide where they want to start. They may want to start at the very bottom. They may want to start at something mid-level. But like you said, it also depends on the importance of it. There may be something that they need to do, like go to school or
get on a plane and go to California.
Yeah. So that's it's high on the list and it's coming. So they may have to, the circumstances may force a little higher up on the hierarchy than they're comfortable with. So yes, it's definitely, and I tell people all the time, that about that, I'm not going to ask you if you have social anxiety. The first thing I want you to do is, and I'm going to arrange for you to make a speech about thermonuclear dynamics to 1,000 people next week. Okay, we're going to start with things like asking for where the green beans are at the grocery store, or just talking to your family more if you're kind of isolate your room, just practice a little bit at a time and build on that.
Yes. This is an analogy for this would be physical therapy. If you've had an injury and you go to a physical therapist and you need more range of motion in your arm because you've had it tied up against your body while something was healing. Well, just starting to move it a little bit at a time hurts. But it's only through that effort that eventually you get the full range of motion back. And it's painful.
Right. And if you can't do it, the physical therapist might get it up there for you.
They will definitely
Because
do
the
that.
point is it's got to get up there somehow. If you can't do it, it's got to get up there. And, I know you have personal experience with this. And I
Yes,
remember
do.
watching you jump your arm up, using your momentum to get your arm to go up.
It was a little bit of a cheat, but it worked. But it works now, So
yeah, that was part of the hierarchy. It's just get that thing up there.
yes. Yeah.
So anyway, there's so many different uses for exposure, and people are doing exposure that aren't in therapy all the time. Every time they do something that's a little difficult, that's a little challenging, that they'd rather not do, that's exposure. And when you get used to it and you get better at a sport, when you get stronger in the weight room, when you run a little further, it's a result of exposure and growth.
Yes, you're learning to tolerate the discomfort. And it's interesting because as you learn to tolerate the discomfort, your discomfort drops.
It's the name of the game.
Yes, it is. And it's true in physical, training as well.
Sure.
So you
get less tired.
Yes.
Got more wind at the end.
Yes. Heart rate lowers. You become more efficient at pumping blood through your body. It's a good analogy. Do you think maybe at some point we should look at some of these specific things, maybe take something like social anxiety, or talk about some of the types of OCD that we deal with, and kind of take people through a scenario, what that kind of treatment would look like?
That sounds like a good idea for the future.
Okay.
Yeah, today was really about the general uses of it and basic explanation of it, and we can get into more detailed stuff in the future. But I think it's a good place to wrap it up.
Okay. Well, as usual, I enjoyed it.
Me too.
The exposure is good for us.
Yes, it's good exposure to get on camera and risk saying something wrong and then not remembering the book that you've contributed to.
Yeah, that you're a co-author on. Yes. Oh, well, it's a little bit of, we can tolerate it. Okay.
We can tolerate it. And part of the treatment too, and the thinking process is, with the worst case scenario, it's, what if that happens? So what? And being able to go, okay, the worst thing happens. Okay. So what if I forget the name of the book?
It doesn't matter.
All right. Well, thanks everybody for watching. And I always forget this, but please subscribe.
Please subscribe.
Rate, review. Tell us how awesome we are. And give us suggestions for topics in the future. And we really appreciate everybody tuning in.
We got stressed cause we're striving, surviving, keep on moving to improving, rearranging. The whole world's changing, pandemic, systemic, rule making.